What is FUE hair transplant surgery? Follicular unit extraction hair transplant surgery is a surgical procedure used to restore hair to areas of the scalp that are bald or have thinning hair. FUE is a minimally invasive hair transplant technique that involves extracting individual hair follicles from the donor area of the scalp and implanting them into the recipient area or the balding area. In this way, the patient's own hair is transplanted, producing a natural looking hairline and a fuller head of hair. FUE hair transplant surgery is usually performed in an outpatient setting and is typically done using local anesthesia. The procedure usually takes several hours depending on the size of the transplant area and the number of hair follicles that need to be extracted and implanted. The FUE hair transplant surgery begins by shaving the donor area of the scalp, usually located at the back of the head. Then, using a small handheld instrument called as micropunch, individual hair follicles are extracted one by one from the donor area. The punches used for FUE hair transplant surgery range in size from 0.6 mm to 0.8 mm in diameter, allowing for precise extraction of each hair follicle. After the extraction, the donor area is typically covered with a dressing to protect it and allow it to heal. Next, the extracted hair follicles are prepared for the implantation into the recipient area of the scalp. The recipient area is typically prepared by making a small incision or slits in the scalp, where the extracted hair follicles will be implanted. The hair follicles are then carefully placed into the recipient area, ensuring that they are placed at a correct angle and direction for the most natural looking results. After the FUE hair transplant surgery, patients will usually experience some swelling and discomfort in both the donor and recipient areas. Pain medications and anti-inflammatory drugs can be prescribed to manage these symptoms. Patient will also be given instructions on how to care for their scalp after the procedure, including how to clean and protect the transplanted area. While FUE hair transplant surgery is generally considered safe, like all other surgical procedures, it does come with some discomforts. These include oozing, infection, fine scarring, and damage to the surrounding tissues. However, with an experienced and qualified surgeon, the risks associated with FUE hair transplant surgery are generally negligible. FUE hair transplant surgery is an effective and minimally invasive procedure that can provide long-lasting and natural-looking results. It is important to choose a qualified and experienced surgeon who can perform the procedure safely and effectively. Patients should also have realistic expectations for the results of their FUE hair transplant procedure, as it may take several months to see the full results of the procedure. In conclusion, FUE hair transplant surgery is a surgical technique used to restore hair to areas of the scalp that are bald or have thinning hair. It involves extracting individual hair follicles from the donor area of the scalp and implanting them into the recipient area or the balding area. The procedure is minimally invasive and the results are usually natural looking and long lasting. While the risks associated with FUE hair transplant surgery are generally very low, it is important to choose an experienced and qualified surgeon and to have realistic expectation for the results of the procedure. Thank you for watching this video. If you have any questions about hair transplant or any other cosmetic or medical treatments, please don't hesitate to contact us for a consultation at Dr. Haror's Aesthetics.